Hi eGP learners. In this episode of Tip Thursday, we're going to have a look at one of the best primary care paediatric resources I've been able to find called Paediatric Pearls. Let's tech enhance your primary care and learning. If this is the first time we're meeting, I'm Dr Gandalf of eGPlearning, where I look at supporting you with technology-enhanced primary care and learning. And in this episode, we're going to have a deep dive look at a website called Paediatric Pearls, or if you follow them on Twitter, at PeedsPearls. It's a really useful website full of resources and signposting to guidance, as well as a great way of ticking off your CPD for appraisal on pediatrics and stuff. As always, if you want to watch the full video, subscribe on our YouTube channel, or follow us on Facebook at eGPlearning, or you can contact me on Twitter at eGPlearning or at Dr Gandalf52. And as always, subscribe, comment, share, and let's tech enhance your primary care and learning. See you later, guys. Bye. Hi GP learners. So on this episode, we're going to have a deeper dive look at a really useful website for primary care pediatric resources called Paediatric Pearls, or if you follow them on Twitter, at PeedsPearls. You can always search for them on Google, or alternately, you'll find them on the Paediatrics resources page on the eGPlearning.co.uk website. And I find this so helpful, it's actually got its own section on the page itself. So talking not only about the website, but some of the resources as well. So as you can see here, it's just in this section. And when you click on it, it takes you straight through to the home page. And here we go. So this is the Paediatric Pearls website. As you can see, it's effectively a blog page, and it has some really effective resources and stuff. So it tells you about how you can follow them on Twitter and contact them in that route. And more commonly, the first thing that you'll come up against is the PDF digest that they have, which they update on a near monthly basis, as you can see by the blogs there. These are really helpful, and they've got separate ones for both emergency departments as well as for general practitioners. And these updates, I'll be honest, are probably one of the best ways of ticking off some pediatric CPD stuff if it's on your agenda for your appraisal or revalidation aspects and things. The digests are really concise pieces of information that give you updates in terms of various different categories and how to manage conditions, for example. And I find them really effective and useful, and a great resource for GP trainees as well. A little bit more about the website itself. It's actually created, as you can see here on the About page, by Dr Julia Thompson, who's a consultant paediatrician down in London. And working with her, she's got a team of other doctors as well, and some students in particular, as you can see here. So really good quality stuff. And, you know, they do point out that they try their best to keep this as up to date as possible. And effectively, the website runs really, really well as a result of it. If we go back a little bit. So when we go to the various resources, so there's a section on parenting resources, as you can see here. This admittedly is more focused around the area that they work in Waltham towards London and stuff. So a lot of the resources on this page are more geographically focused. However, there are some national links to various resources for parents and stuff on there for different age groups of children. There's a whole section on safeguarding, which I'd really recommend having a look at. It's got some really good resources and stuff and things. But the main ones that have a focus are like I said, the PDF digest and the primary care guidelines. So this page I absolutely love. Effectively, any clinical condition is covered. And what the really useful thing about this particular website is that they've actually scoured the entire country for the various different guidelines and resources. So this isn't regionally dependent or anything like that. This is taking some of the guidance from across the whole country and collating it and presenting it in a way that's really effective in case you need this kind of resource. Admittedly, for Nottingham, they've started doing this their own for the local guidance and stuff. So compared to how effective this website used to be for myself, it's probably not as relevant in my clinical practice. However, I still find looking at this guidance really useful. And the fact that it brings in different viewpoints and different perspectives, I think is also really effective in helping in terms of navigating challenging cases and that kind of stuff. Prior to that concept of either referral, or actually even those more chronic complex patients that do need that extra support, getting some extra awareness and things, and as I said, particularly for CPD, really good. So I'd really recommend having a look at this website and using it on your daily practice in terms of getting a good idea of various clinical aspects of pediatric care that you may need and basically want to use and stuff. The team at Paediatric Pearls are always happy for contact and stuff. You can contact them on Twitter. As I said, their handle is at PeedsPearls. And their Twitter page is pretty well updated and stuff, and they do seem to respond quite rapidly as well, which is nice as well. Anyway, guys, I hope you like this slightly deeper dive into this really useful clinical resource in terms of signposting, resources, and appraisal and revalidation source and things. As always, guys, if you want to find out more of our Tip Thursday kind of tools and stuff, make sure you follow and subscribe on our YouTube page at eGPlearning, or you can also contact us on Facebook as well at eGPlearning page, where you'll see our regularly updated Tip Thursday updates and stuff. Alternately, contact us ourselves on at eGPlearning at Twitter, or at Dr. Gandalf is my personal one if you want to contact me as well. More than happy to help and stuff. As always, guys, subscribe, comment, share. Let's take enhance your primary care and learning. See you later. Bye.